Acute bronchitis is a chest cold that occurs when the bronchial tubes get irritated and inflamed, producing mucus that makes you cough. It may or may not be the result of a bacterial infection, which makes this question a difficult one to answer. For the most part, bacterial bronchitis and airway inflammation are not contagious per Southeast, says Health Editorial Advisory Board member David L. Katz. MD, Director of Yale University Prevention Research Center in New Haven, Conn, and founder of True Health Initiative. Often, however, the precipitant for a bout of bronchitis is a viral infection of the upper airway, frequently called a cold, and these, of course, are contagious. In other words, patients should think of acute bronchitis as more a symptom of an illness rather than an illness itself. Generally, bronchitis is a complication of an infection involving the upper respiratory tract, explains Dr. Katz. That infection is usually viral and contagious. The complication of the infection, bronchitis, is not contagious. However, the subtlety here is that some viruses can cause bronchial inflammation even in the absence of prior vulnerability of bacterial infection, so the no in this instance is a qualified no. In addition to acute bronchitis, more than 12 million Americans suffer from chronic bronchitis, which is one form of chronic obstructive pulmonary disease, COPD. This condition is typically brought on by cigarette smoking, and is not contagious. Well, the signs are there. Your throat is scratchy, you've been sneezing one too many times, you feel a headache coming on. Yep, you're getting sick. Don't give in to your illness just yet. These 4 easy prevention methods can help you ward off that pesky cold, or at least ease the symptoms. You may shave 2 days off a cold, per our 2012 review. Look for lozenges with zinc acetate or zinc gluconate and take one every couple of hours while symptoms last, says Lisa Kuchera, PhD, Professor of Biomedical Science at Quinnipiac University, in Hamden, Conn. It's not just an old wives' tale. This staple can help relieve symptoms of a cold, according to a study from the University of Nebraska. It likely won't prevent a cold, but a review of 29 trials found that taking vitamin C daily as soon as you feel that first symptom may reduce your downtime by about 8%. You need about 1 gram, 1,000 milligrams, a day. During sleep, your immune system releases proteins called cytokines that combat infection. Getting enough shut-eye consistently will also help you prevent more sniffles in the future.